All right. Well, welcome everybody. We'll give it just a few more seconds as people just come into the session from the waiting room. It's up to over 50 now. We'll give it a few more seconds and give folks a chance to come in. If you can, as you come into the room and we're giving a little more space, if you could just put in the chat where you are from, city and state perhaps, um, and perhaps your role, whether you are a caregiver, someone that is supported by caregivers, perhaps you are a paid caregiver, a nurse, an aide, just a little snippet about yourself would be great. Detroit, Indianapolis, oh, Indiana, Traverse City. There's always a Traverse City in there somehow. A good friend of mine grew up in Traverse City right there on the lake. Wow, cool. Well, we've topped over 100 right now, and that seems to be where we're leveling out for the moment. So I'll go ahead and get started. My name is Marvell Adams Jr. I serve as CEO of the Caregiver Action Network. The Caregiver Action Network is a not-for-profit based in Washington, D.C. with a national reach. We support family caregivers across the country with resources, educational sessions, just like the one you're going to see today with our great partners at First Quality, and a whole host of other support systems and resources that can be found at caregiveraction.org. But just wanted to kick off today's session, one that some might say is taboo, but we say at Caregiver Action Network, there is nothing that is too taboo to discuss when it comes to caregiving. And caregivers have a wide array of topics and things that they really need to be aware of. And incontinence is one of those things. So, I'll share just in the sense of my own background that my original career many years ago was as a nursing home administrator at the age of, let's say, my mid 20s. And incontinence, as you might imagine, is a part of that work. But what I gained from that in conversations with families over the years and with residents and other individuals that may surround and support them is that having supportive supplies and equipment and therapies around supporting and helping with incontinence is just as important of a tool as a band-aid is, just as important of a tool as wrapping someone's arm after a bruise or something like that, and just making sure the individual really has all they need to be as independent as possible. So, today is really an important aspect, I think, of our work at Caregiver Action Network because it's important for us to bring to everyone the types of tools and resources that really provide them the information they need, no matter what that information may be. So, what I'd like to do is also give a great welcome to our partners that are with us today. Um, oh, excuse me. With me today is Kimberly Owens, who is oh, Kimberly, I'm sorry. I totally lost your title there. I'm like, look, I'm befuddled trying to look for it. There it is. Kimberly Owen, there you are. I will allow Kimberly to say her title because I think the thing that's sticking with me the most, Kim, is one thing that I would expect from you in your background, but I was so glad to hear right before we joined, which is that Kim said, I could talk about incontinence all day long. And we're not going to do that today. But the fact that Kimberly has that vast amount of knowledge is, quite frankly, important for our folks out there today that are paying attention to this webinar. So, Kim, thank you so much for being with us today from our good friends at First Quality.
Thank you, Marvell, and I appreciate Caregiver Action Network giving us the opportunity to talk about incontinence. And I think you said it very nicely, and it's a taboo subject, and people really are nervous about talking about it. It's so private, and I'm hoping that after our conversation today, they walk away and feel a little more confident, a little more secure, and we've given them some great solutions, either for themselves or for the person that they're caring for. And before we get started, Marvell, I would love to read our disclaimer as we move into the context, if that's all right with you.
Please, yes.
This material is for informational purposes only. It does not replace the advice or counsel of a doctor or healthcare professional. The authors make every effort to provide information that is accurate and timely, but make no guarantee in this regard. You should consider consulting advice from your physician or healthcare provider. Certainly, as we talk about medical conditions and things like that, it's great to know that we do our best to make sure our information is accurate. But if you're experiencing any problems, always seek that advice of your physician or healthcare provider. All right. Marvell did a nice job at introducing myself. Again, I work for First Quality and I'm a clinical services manager, and I truly could talk about incontinence all day long. I'm very passionate about it, as we are here at First Quality. Our goal is to manufacture high quality products for you and your loved ones. But as a clinician here, our clinical team is here to really help you understand what incontinence is and how to navigate that unforeseen world that many of us are nervous to talk about. And thank you, Marvell, and the Caregiver Action Network again for this opportunity. So there are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And that's a pretty strong statement. And if you read that and think through it, it's, wow, I never really looked at it at that perspective. We all will be one of these individuals, if not several, and highly possible that you will be all of them. So take that with you as we navigate through our session today. So what exactly is incontinence in this word that we keep referencing? In layman's terms, per se, it's bladder leakage. When we refer to urinary incontinence, it's bladder leakage. You will hear that in common conversations. In bowel or fecal, it's the inability to control your bowels. You may have some unexpected leakage of fecal matter. And we'll use that term incontinence and bladder leakage kind of interchangeably. And through different points of the session today, I'll talk a little bit about specifics of each of those. But before we get started, we'd like to ask a couple of questions. First, is incontinence a normal part of aging? And I believe you'll have a poll box up there, and it'll be interesting to see how everyone feels about that. So right now we're kind of 50-50 that it is, and looks like 50%, a little more than 50%, believe that it is truly part of aging. We'll give you all a couple more minutes. We almost have everyone answering. True, it seems to be everyone feels that yes, that's a normal part of aging. Okay. Couple more seconds. And the results are in. They are true. Incontinence is a normal part of aging. Actually, that is false. Whoops. Incontinence is not a normal part of aging. That is a common misconception, and we're going to talk a little bit about that today, and why incontinence is not a normal part of the aging process. I have one more question for you all before we get right into the content. How common is incontinence, and how many millions in the US experience some level of bladder leakage or type of incontinence? 20 million seems to be leading at the moment. Great answers. 20 million, 10 million. Few more coming in. Looks like 10 million is the leading answer. I'll give you a couple more seconds. We almost have everyone. And it looks like 10 million is the most common answer. When we look at incontinence and how many million Americans, it is actually 25 million Americans in the US experience some level of incontinence or type of incontinence. So who are those individuals? Over half of the population who are 65 or older living at home are experiencing some level of bladder leakage. There are more than twice as many Americans experiencing incontinence or living with some form of bladder leakage than there is with diabetes. And diabetes, we hear that all the time, right? You can turn on the TV, social media. Everyone's very comfortable with talking about diabetes, but twice as many Americans are living with incontinence and no one wants to speak to it. So that's why we're here today. Incontinence is more prevalent in the female population. There are 18 to 20 million women in the US experiencing some level of bladder leakage, and that's primarily because of the life stages that we go through as females, from pregnancy to childbirth to menopause. And we'll talk a little bit about that as we navigate through today. There are 5 to 7 million men that are experiencing some level of bladder leakage or type of incontinence as well. Before we move into the adults, I do want to talk about a very special population. I imagine we have some individuals with us today who are caregivers of children, and that is a very special population to me as a clinician. I've always loved working with children as well. And when we say children and we're talking about this topic, we're referring to the child, the youth, your preteen, the teenager, and that young adult who may be living with a type of medical diagnosis or condition, and they're experiencing some level of bladder leakage or incontinence related to that condition. Things like neurological disorders, structural abnormalities of the urinary tract system, some developmental factors. Children who have ADHD, autism, anxiety and stress, and sleep disorders also may experience some type of bladder leakage and or bowel incontinence. So it's not uncommon to see children in that age bracket to have some type of incontinence as a symptom from one of their medical diagnoses. So as we navigate through today, be thinking about that population as well, because everything we do talk as we move through product selection and incontinence relates to them as well. It's not just adult focused. And as we mentioned, the adults, it's good to kind of understand some of the medical conditions and the signs and symptoms or the causes per se that can cause an adult to experience some level of bladder leakage or incontinence. Of course, diabetes, as we mentioned earlier, that's common in both children and the adult population. Neurological deficits, those disease processes that may impact the neurological system. We can see that people who have those conditions could have some level of bladder leakage as well. Urinary tract infections, that's a pretty common one that people don't associate that with incontinence. And with UTIs, what will occur is you feel that urgency with the infection and you need to rush to the restroom and you may not be able to make it there. Certainly, as the infection is resolved with medication, the incontinence seems to subside from that. From a female standpoint, I talked earlier about women having more prevalence with some level of bladder leakage due to life stages. As we enter the menopause stage of life and our hormones shift, we begin to lose estrogen, which causes us to lose that muscle elasticity, that muscle strength, and that can impact our pelvic floor. Gentlemen can also have the pelvic floor muscles impacted from a variety of conditions as well. But when you tie in the hormones and you look at immobility and deconditioning, or just that immobility, right? We're not up and moving. We're not getting the exercise that we did before. And we start to lose that muscle strength. What happens is you'll lose that in your pelvic floor, and your pelvic floor supports your bladder. And then you may start to experience some level of bladder leaks due to that loss of muscle strength there. Chronic illnesses, of course, we know that urinary incontinence can be some type of symptom from a side effect from that as well. And I want to talk a little bit about bowel incontinence. Of course, everything that we mentioned earlier was primarily focusing on bladder leakage, but bowel incontinence is very similar to urinary leakage. And you have your digestive issues, your GI components. For instance, if someone suffers with Crohn's disease or irritable bowel syndrome, they may be more susceptible to have some level of bowel incontinence throughout their lifespan. The same with digestive tract disorders. Diarrhea, chronic constipation, and fecal impactions can lead to some level of bowel leakage as well. Nerve damage and neurological diseases, if there's any brain or spinal cord injuries, rectal surgery, or even damage to, say, the GI system, the pelvic area, the abdominal area related to radiation, that could have caused nerve damage, could lead to an individual dealing with some level of incontinence as well. And then neurological diseases. And I think when we ask the question, is aging, normal, is incontinence a normal part of aging? We probably tie that a little bit to some of the disease processes that primarily impact the older population, like dementia, Parkinson's, muscular sclerosis, cerebral vascular accidents, strokes, or CVAs. Those occurrences are usually in the adult population and that more elderly, and it leads us to feel like incontinence might actually be more when we age. As you have that neurological damage and you can no longer control certain aspects of your body, that can cause you to lose control of your bowel and bladder as well. And Marvell, certainly I know you have a great history in healthcare as well. Is there anything you'd like to add for talking about the types of incontinence and the disease processes?
Yeah, Kim, thanks so much for just giving us the breadth of which the number of ways that incontinence, can be a outcome or result or symptom of the underlying condition. Many of which that gosh, many years as a nursery administrator, it had not occurred to me. Many of them did. But I also appreciate the fact that, giving the understanding that this isn't just about adults. This really is something across the lifespan, which for Caregiver Action Network was a part of the reason that we really wanted to partner with First Quality, because you do support across the lifespan when it comes to caregiving, because there's just so many different aspects of it, and none more important or less important than the other. But as you look at these different types of conditions and common causes of bowel incontinence, you immediately think to yourself, wow, I probably know a few people with some of these things, and it never would have occurred to me that bowel incontinence could be a part of that. And so I think it also gives us this sense that the more you talk about something, the more you can normalize it and make sure that, okay, this terminology, these types of things really aren't taboo. They are, unfortunately, as you said, impact 25 million Americans every day. So yeah, thank you so much.
No, and you just said something, Marvell, that I think struck home with me is normalizing the conversation, right?
Mhm.
It's really, we talk about diabetes, twice as many people have incontinence than they do diabetes, and we're more apt to talk about diabetes and the side effects from that and the disease process, but we don't want to talk about incontinence. And our goal is really to normalize that conversation. And certainly by partnering with you guys, we're hoping today it helps us make more strides in that direction. So let's talk about some things that you all may be aware of or may not. Diet and exercise. As you can see, we mentioned the disease processes, but we know that eating a healthy diet, getting moderate exercise for our overall body health, right? Cardiovascular, make sure our heart's strong, our respiratory system, but also your diet and your exercise, you can start to see can impact your urinary and your GI system as well. So I want to share a few things with you that you may not have seen before. Certainly the first one is water. How many times do we hear the importance of water and staying hydrated? And yes, everybody wants to drink their amount of water each day, stay plenty hydrated. But what happens if you don't drink enough water? When you do not drink enough water, the urine sits in the bladder and it actually becomes very concentrated, and it can irritate the bladder and potentially lead to incontinent episodes or bladder leakage. And then quite the opposite. If you intake too much water and you have an overabundance amount of water in a particular day, you could see your need to void or to urinate could increase, and the potential to have an incontinent or bladder leakage episode is there as well. My favorite, though, is caffeine. I'm sure many of us on this call today love our coffee in the morning. Maybe it's 1 cup, 2 cup, maybe 3 or 4, but coffee, soft drinks, even sweet tea, and even chocolate, they all contain caffeine. And what caffeine is, it's a bladder stimulant. So it does exactly that. It will stimulate the bladder and it'll cause you to have to use the restroom more frequently. With that, could potentially cause the bladder leakage. Bladder irritating foods, tomato products, anything that's pizza, salsa, spicy foods, any citrus fruits like lemons, oranges, those things are also bladder irritants, which have been known to actually increase the potential for bladder leaks as well, as it may irritate the bladder. I want to talk about skin for a little bit. Skin is very important, and often as we're moving through incontinence, we don't think about skincare, right? If you are a new caregiver for a family member, or is you are new to incontinence yourself, people don't think about proper skincare or what incontinence could do to the skin. Um, Exposure to the skin from urine and or bowel can actually cause irritation. If exposure to urine and bowel can actually cause skin irritation, inflammation, and potentially lead to infection. And know that's through prolonged exposure to that. What happens is you have that moisture sitting against the skin, it becomes macerated and it becomes more susceptible. And as you think about the disease processes that we were talking about earlier, you can see where someone may have skin that becomes in jeopardy. For instance, diabetes, they may not heal as well, and the potential is there for their skin to be a little more at risk. Also, if you're caring for someone who is sitting or lying down a lot and they've become incontinent, you want to make sure that we're getting them up and that we're changing their products. It's really important that we're providing that skincare with each incontinent product change, whether it's urine and or bowel. And here the images just give you an idea of someone's incontinent, kind of the more common areas that you may start to see that irritation at. And certainly if you or your loved one's experiencing that, you want to seek out advice from your medical provider. So when we talk about, and we do have a question, I'm sorry, I'll back up for 1 second. Someone's asking of how long is the exposure? When you are talking, it's a great question, right? From an exposure standpoint, you want to make sure when someone's utilizing an absorbent or incontinent product that you are changing them every time they have a bowel movement. That should be changed as quickly as possible. Bowel is caustic to the skin. It can actually cause breakdown very quickly. If they are incontinent of urine, you want to make sure that you're changing them when there's a wetness indicator. I'll speak to our Prevail product specifically. There's an indicator there. And as soon as that's activated, that's when you will want to actually change the product. We never want to say, we want to make sure that we're changing and providing that skincare as quickly and as soon as possible. So as we look at some signs of incontinence, and I can certainly speak from a personal standpoint, and I'll tie that in with this, is, my expertise is in incontinence. And as a clinician, these are things that I've seen across my career with people who are experiencing some level of incontinence. As I was helping care for my grandfather, I was able to see some of these. Some of them did not stand out quite as quickly as others did. But if you are new to caregiving, or if this is you're caring for your family member, or you're working as a professional caregiver, these are some simple signs that are very common of someone who may be new to incontinence. Towels and seating areas, maybe it is in a recliner, their favorite chair. You may find them in the bed. Sometimes there's blankets there as well. What has occurred, they've had an incontinent episode and they're trying to provide that protection. Because remember, they're embarrassed, right? They're embarrassed. They don't want to have these conversations, and they're probably trying to keep it to themselves and think that they can manage that and don't want to come to us for guidance or advice. Overabundance of toilet paper, paper towels, and napkins. What you may notice is your paper towels start to diminish much faster. And what is occurring is they're likely using that as an incontinent product. It's very common, particularly in females. You will see this a lot, is as they begin to experience some level of incontinence, they are using toilet paper, or they're taking paper towels and they're placing it in their own undergarment. With females also, they will utilize feminine hygiene products. We're comfortable in that aisle. We use that during the years while we were menstruating. It's very comfortable for us to walk into a store and walk down the aisle and go, yes, this is what I use. I'm going to use that. Feminine hygiene products and incontinent products are designed very differently, and we'll talk about that in a moment. Missing or hidden clothing. Personally, this was something that my grandfather had started to do, and we would find clothing in the most random or inconspicuous places, we noticed some of his favorite clothing would go missing, and then we would find those items that had been sold, shoved in a bucket or a trash can. You may find them sitting in the laundry basket, but you can start to pay attention to their clothing in the closets. With that, increased in laundry, right? Maybe mom did laundry every 2 or 3 days, and now you're noticing she's doing it every day. She's probably doing laundry because she's had an incontinent episode or some bladder leakage, and she's trying to get her clothes cleaned and not share that with you. Limiting fluid intake. We talked about the importance of staying hydrated and what could occur for not getting enough fluids. And then certainly increased use of powders and perfumes. You may see a little uptake in that as well, as they're trying to cover that scent from a bladder leakage, or have it there in place in the event they have an incontinent episode. Two that I think are very important, we've talked about, being healthy from a diet and exercise standpoint, from a body and just maintaining overall great health, but from a mental standpoint. When you have someone who's new to incontinence, they're already dealing with, they're very embarrassed. They don't want to talk about it. It's such a sensitive and intimate subject. What you may find is they become very anxious. They don't want to leave home. They no longer want to go to church on Sundays. They don't want to go shopping. They're not up to going to family dinners. They're anxious to leave the house. They're scared if they leave that they will not be able to, that they may have a bladder leakage episode and won't have the appropriate protection and may soil their clothes while they're in public. With that, you also start to see them isolating. We see them isolating, usually in the bedroom or in the room closest to the restroom. And we just did see a question about products, and we'll be talking about products and costs in just a moment. I did want to address that very quickly. But again, to the mental health component of that, you will see the anxiety start to increase in the isolation. Being socially interactive with family and friends is very important. It's actually just as important as your overall health. So these are just some signs of incontinence to keep in mind.
Kim, as I was, seeing you go through those different items, there's also a domino effect that sometimes isn't talked about. In the sense of, you laid out the fact that one way someone may try to manage their incontinence is by less fluid intake. And so by less food intake, then they're perhaps more likely to be dehydrated, which can then mean they're more likely for a UTI, which could make them more likely to have to get up at an irregular time in the middle of the night. UTIs also can cause a delirium or disbalance and lead to a fall. And it seems as if those things would not be attached at all, having a less fluid intake so you don't have an incontinence issue in your mind, but can lead to bigger issues down the line because you're not addressing the core issue at the beginning.
That is a great point. And you did such a nice job, Marvella, of tying that all together. Because, right, as you and I have a background in healthcare, so we're used to connecting those dots. But as someone who may be new to caregiving, right, they may be new to taking care of their parents or grandparents, would not think of those things. And I'd like to add to that as well as the fall risk, right? If we're
Mhm.
experiencing these, we could get up at night and potentially fall. And when we get into products, which will be in just a moment, it's really important to have the right type of product, and it's okay to have a variety of those. And as I talk about our products, I'll kind of touch on that because I think a fall risk is a good point to add to that as well. So I think from an incontinence standpoint, we've shared a little bit about what it is, some of the common signs and symptoms for you to look out for as you're caring for someone. Um, there's also 5 types of bladder leakage. I certainly don't want to overwhelm anyone with this, but it's very important to understand this because it leads you into being able to find the right type of product for yourself or for your loved one. Understanding that there's different types of bladder leakage, that it's not all the same across the board, will really help you personalize that care for your loved one as you're looking at product selection. And I will always go from left to right. It's from light to heavy. So as you start to picture these, just picture the light bladder leakage at stress, and then it'll become the heavy as we get into functional. Stress, again, I'll go back to females. It's very common in females who are pregnant or after childbirth, and it's a little bit of a dribble, right? It's Just a couple of drops, may laugh or sneeze and have a couple of drops there. It's also very common in gentlemen that have enlarged prostate or have dealt with prostate cancer. So think of just a couple of drips there. As we move into urge, we've talked a lot about urinary tract infections today. One of the symptoms of a UTI is that urgency, right? When we come into a physician's office, it's usually the first symptom of I have a lot of urgency. And with urgency, it's you feel that urge and you're trying to get to the restroom, but you can't, you just can't get there. So it's that involuntary loss, and it's a little more than stress. When you look at mixed, one of the easiest to remember, it's a mixture of stress and urge. There's a couple of drops followed with that urgency, and you're going to have that void after that. We move into overflow, and this is where we get into the heavy incontinence. With overflow incontinence, picture you have a glass and you're going to fill it up with water. And as you're pouring the water into the glass, you keep pouring the water in, and the glass overflows with water. That's exactly what overflow incontinence is. The bladder reaches capacity of urine that it can hold, and then it all of a sudden overflows. Well, just as the water overflows with the glass, it's a very quick gush of water. The same thing happens with the urine. So you can imagine if you're experiencing overflow incontinence, how quickly that urine can exit the body, and how it's really important that you have the right protection. And I'll talk a little bit about the products and to ensure you have the right one for that in the next couple of slides. And with functional incontinence, whoops, with functional incontinence, that is really the urinary system is functioning appropriately, and there's no challenges, no medical issues there, but it's the functional piece of it. Think about someone who, for instance, they have dementia and their body, they're able to function normally, but due to some of the neurological changes, they're not able to control their urine. And I want to tie these into products. I think this is really important. I want to spend a few minutes here with that. With incontinent products, I'll talk again from left to right. And these are our Prevail products. They're manufactured by First Quality. And we certainly, I believe in our products, use them on my family members, anyone that has experienced any type of bladder leakage or incontinence. But again, this part will help you really determine what product to select for your family member. First of all, anytime we talk about products, we've mentioned today that the subject's taboo, there's embarrassment with it, there's that stigma with it. We always want to talk from a dignified standpoint. And one of the things we do really well here at First Quality is when we have conversations about our products, we do that by referring to, say, our protective underwear as a protective underwear and our adult brief as an adult brief. A lot of times you'll hear them referred to as pull-ups or diapers, and pull-ups and diapers are actually designed for babies and children. As we become older, no one ever wants to be in, say, an adult brief or protective underwear. So we want to make sure we're very sensitive to that, right? And if I can pass on any advice today, that's a great talking point if you have to speak with a loved one about incontinent products. The other piece is personalizing the care for this and personalizing the product selection. I'll walk through this, and we also have a guide later that you can reference, certainly from the Caregiver Action Network site. It'll be within this presentation. Bladder control pads, light leaks. We think about that stress incontinence. Females, this is designed for the female anatomy, perfect for your individuals who may be pregnant, after childbirth, anyone that's dealing with that stress, light urinary incontinence. One nice thing about bladder control pads is they come in a variety of lengths and a variety of absorbencies. So you can certainly customize that. If mom needs a light protection during the day and maybe she needs a little more at night, that's okay. It gives you the options to do that. Male guards designed specifically for the male anatomy. The nice piece with both of those products, they have an adhesive backing that allows them to be worn in their traditional undergarments. It also helps promote that independence, right? If they're still up and mobile and able to go along with their day-to-day activities. We always want to promote that, certainly in a safe manner as well. But then there may come a point where they need a little more protection, and that's where our protective underwear, that moderate leakage, someone who does experience a full void when they do have a bladder leakage, meaning they have a full emptying of the bladder, it provides appropriate protection for that. The nice thing about the protective underwear is it's that, again, a great transition from wearing traditional undergarments into a protective product. It has the fit and the softness and feel of, say, a traditional underwear, and it allows them to, one, again, if they're mobile and active in their day-to-day life, it allows them the capability to use the restroom, right? Occasionally, we will see individuals utilize the protective underwear, male guards, and bladder control pads that are still toileting, meaning they're still able to use the restroom independently without assistance, and this allows them to do that. Maybe they're not incontinent every day, maybe it's just a couple times a week, and it could be related to some of the nutritional things that we discussed earlier. We don't recommend our Prevail products for bowel incontinence. We actually would recommend our adult brief. That does have a bowel containment zone. And that adult brief is designed for heavy urinary incontinence. We talked about that overflow and that functional. When you have, for instance, that overflow incontinence, it's really important that you're wearing a product that has a quick rate of acquisition. And what that means is it can quickly absorb the urine because it is expelled so quickly when the bladder leaks. You want to have a product that can fastly absorb that urine, one, to get it off the skin so it's not sitting there, and two, so they don't jeopardize having any leaks and soil their clothing. The nice thing with our adult briefs is we have a stretchy side panel. It's very soft and breathable. Breathability is key with incontinent products. You don't want to hold any heat and moisture in with a product. All of our products have that cloth-like feel, and we aim to do that. It lets the skin basically maintain a normal skin temperature. And if you're incontinent, you don't want to increase moisture there because, again, it can start to jeopardize the skin. So those are the wearables, and we would refer to them. And we know when you walk into an incontinent aisle and you're looking at products, it's overwhelming. Whether you're in store or whether you're online, it's very much, where do I begin? I don't know the difference in these. What is best for mom? What is best for dad? And we'll give you some extra guidance here in a moment, kind of a visual to show you how to do that. Some other products that are really important as you're managing incontinence or bladder leaks for a loved one is underpads. Underpads are really surface protectants. So, for instance, if we were putting those towels down on the favorite recliner, maybe we could put an underpad there. If we're in the car and we're traveling to the doctor's office, an underpad would be ideal to place over the car seat just to prevent any leaks from occurring, or if any leaks actually occurred, it's going to protect your seat. Skincare, we talked again about the skincare. We manufacture an adult washcloth. It's designed specifically for adults, and it's designed for incontinent care. They are very soft. They're the size of a traditional washcloth, and they have great, everything in there is wonderful for the skin. We really want to promote the skin health and skin wellness, and it's a great complementary if you start utilizing any sort of incontinent product. And that's important, right? Make sure that if you're using a product, we want to change them appropriately, and we want to provide that proper skin care.
Kim, I think on this slide we have a couple questions that might be appropriate. So one question from the audience, should an adult day program, so if someone's in an adult day program, should the underpant pads be changed during the day? So I guess it's talking about frequency of changing those.
So yes, if you are wearing adult protective underwear or any of the products, we always recommend changing them once the wetness indicator has been activated. Again, you don't want to sit, you or your loved one to wear a product after they've been incontinent for extended period of time.
And the same thing for the under pads that you would put down under someone as well?
Yes, with the underpads, again, they're surface protectant. Anytime they become soiled, you want to change that out.
Gotcha. And then one other question had to do with, when do zinc products help with skin protection? And maybe that's going to be in a later slide.
So that's a great question. We actually don't manufacture any any skin products. We believe very much into our incontinent products. With zinc products, always follow the manufacturer's recommendation. And I say that because there's a variety of them out there, right? There's a variety of those products out there. And as if with everything that's manufactured by someone different, the instructions are different. I would always advise them to speak with their physician or healthcare provider before using a zinc product or any sort of ointment on the skin, particularly in that area of the body. And if you do use one, make sure that we're not wiping the excess on inside an incontinent product, right? If you're changing one of, say, our briefs and you're using a zinc ointment or any other type of ointment for skincare or treatment in the perineum area, you don't want to wipe the excess on a product. Just as it creates a barrier on the skin, it will actually create a barrier on the product. So you'll see people in Marvell, you probably could talk to that too. I know in nursing home, it's something that we used to see rather frequently as we would apply that cream and the excess would be wiped inside the product as well.
Yeah, I mean it's really all these products, and that's why part of the reason for our talk today is education. Because if you're not well educated on how to use them, if you're not attuned to reading the instructions on it and the do's and don'ts of it, you really just eat away at the efficacy of the product, which is the opposite of what we want to see.
Absolutely. Absolutely. Those are great questions, by the way. Excellent question.
Yeah.
Marvell, I am going to turn it to you. We talked about this the other day and you had some experience, I believe, with the double padding piece, right?
Yeah, because it to an individual, I think it might make sense that like, oh well, in order for my loved one, the person I care for, whatever it may be, or paid caregiver, I don't want to wake them up in the middle of the night. They, just got them to go to get a restful night of sleep. I want to get some rest tonight, whatever that may be, and so double patting them, and it is a counter to what you might believe, but it actually does not help, and so not only just working in residential settings with older adults, with my own mom, who I was a caregiver for a period of time, understanding that the instructions are there for a reason, and double padding actually is worse for the individual because you really are not allowing the product to work the way it needs to. And so, when we were going over these slides the other day, I think my team at Caregiver Action was surprised to see that I had such a breadth of knowledge around double padding, but like it's just such a no-no. And it's one of the things we would constantly educate on and actually even bring in our vendors to educate staff on of like, there are other products available that can perhaps provide the level of absorbency that you're looking for when you think you're getting that through double padding. And so it's as simple as it may seem is like to just put a second one on there. The better response is to really figure out, okay, how can we find a better product that could, perhaps be used on its own.
Absolutely. And you said that beautifully, right? It is a natural instinct for some people. And kind of how you sum that up is find the better solution and it's find the right product. If someone is feeling the need to do this, what we find from our clinical practice is it's typically one or two things is they're in the wrong type of product. So think back to the level of leakage that they're having or the type of incontinence, and they're not in the right type of product. Maybe they are really having that overflow incontinence, but they're in a protective underwear and it's not absorbent enough. So we could move them into, say, the adult brief. The other is sizing. The misconception, and I don't know if you've seen this over the years, Marvell. I know I have since probably, week one of nursing school of, the misconception in incontinent products is the bigger the better. The bigger the better, the more absorbent, the better it is for them. And much like double padding, it's exactly the opposite, where particularly with Prevail, our products from a size standpoint are designed from a size standpoint, the waist, height, and weight to fit the individual, but the cores, say in our medium, large, and extra large, are the same. They're going to absorb the same amount. So the bigger is better, and the double padding are two of the things that really occur. Make sure we're getting the right product type. Make sure we're using the right size. From a clinical standpoint, and to kind of support what Marvell was saying, is what happens when you place that product in there. they have a waterproof backing, right? It's the urine is not going to go through the primary pad into the second product. It's actually the pad will absorb what it can, and the excess will roll over into the secondary product. And so then you start looking at skin risk, skin irritation, and potential for infections because of that as well. So when in doubt, kind of take a step back and assess the situation and kind of look at the types of leakage and make sure we have them in the right product in the right size. Quality and cost. And I know we had a few questions throughout the session today that are really talking about quality and the cost of products and which one's better, right? Which one do I look at? That incontinent aisle can be so overwhelming, whether it's you're online or you're in store. And where do I start? Incontinent products are not cheap, right? They are an expense, and we don't want you to sacrifice one for the other by any means. So make sure that you are looking and exhausting all means to assist with that. Quality materials. I'm a big advocate for that, being a wound care nurse and certainly working for First Quality. It's one of our pillars. Everything that we manufacture, we want high quality products because we want to take care of your loved ones, right? We want to make sure that we're giving you something that we would place on our loved ones. So quality materials. FSA eligibility. There are incontinent products in your FSA catalog. Take a look in there. Use your FSA funds to be able to use that as an expense as well. From an insurance coverage standpoint, there are a lot of states in the US that cover incontinent products. If we have caregivers on the call today that are caring for the disabled children, please reach out to your state insurance provider because they actually will cover the children's incontinent products as well, as adults as well. It varies state by state, but it's a resource that people often don't think about. And they just think, oh, well, they're not going to cover that. Reach out to them, call them, and find out. Certainly use those resources. And again, ask your physicians because there are other policies, insurance policies out there that they may be aware of or other resources to help cover that. At the end of the day, we want you to have a quality product. It's going to provide, the protection, promote the skin health, and certainly at the end of the day, give your loved one that confidence and security to really be able to live normal day-to-day lives. That's our goal, normalizing incontinence and letting everyone be able to feel secure enough to continue throughout the day with normal activities. Finding that right product, and Marvell, I don't know about you, but I've seen a lot of incontinent products over the years, and it's from a quality standpoint, I will always lean towards quality for a product, but when it comes to looking at incontinent products, there's a few things you want to also take into account. Is we talked about product type and size. Those are the baselines for you when it comes to looking for a product for your loved one. That breathability, I mentioned that earlier. Incontinent products have come a long way. They used to be plastic and have tape tabs, which were all detrimental to skin. Absorbency speed, I talked about that earlier, and you want something that's going to absorb very quickly. Refastening and self-closures, that is excellent, especially if you have someone that is mobile. Maybe they need a little bit of assistance when they're using the restroom, but having that capability to unfasten and refasten, and maybe you need to provide some type of skin care throughout today, and there could be some other things, medical conditions going on that require you to be able to refasten and unfasten the product. Capacity, absorbency level, right? How much does it need to absorb? Bladder control pads have a variety from light to heavy to moderate absorbency, making sure the capacity is what you need for the level of leakage that is occurring. And again, I can't mention skin health enough. It's very important. And I think it's important to say as we're looking at cost and financial pieces when it comes to incontinent products, they're not cheap, right? They can be very costly. But if you're not maintaining healthy skin and using a quality product with these features, you can start to actually have additional financial occurrences related to skin, whether it's irritation or inflammation. So it's one of those, pick the product, up front, get a good quality incontinent product, provide the skin care, and make sure we're changing the product and so forth as it should. and that's going to help you down the road. The last thing we want is infection or a pressure injury or anything like that, because they become very costly and painful for the individual. Is there anything you'd like to add? I know, Marva, I kind of started that earlier, but with just your expertise over the years, something you may have seen with the products that you feel are important?
Yeah, you hit the nail on the head. I totally agree with you when you're talking about the right product size, the right usage, because one of the first kind of quality improvement projects I had um, um, working in a nursing home was trying to. Everybody's always tried to cut down on supplies, and they had recently changed the types of underwear and briefs they were using, and they were supposed to be cheaper, but they ended up spending more money because staff were finding they did not work as well or they weren't as good of a quality, and so they were using more of them. And so this gives you just the understanding that the finding the right size and the right type is really the number one priority, because if it's working the way it should, you aren't going to be hopefully utilizing them at a pace where you're feeling like, oh my God, I'm going through these like, so quickly. And that's because you may have just like not the right fit for the right situation.
Well, and just kind of a question came in, what's the difference in double padding and a booster pad? And it kind of ties to what you were saying. Prevail, we don't manufacture booster pads. I can speak to our products. We believe in wearing one product, and we design our products to be worn with just one product at a time. There are things as booster pads out there on the market. I am not able to speak on them because we don't have them here at First Quality. My recommendation, if you are looking at a booster pad, really go back to the things that Marvell and I were just talking about. Having the right product, having the right size, no matter which incontinent manufacturer you're using, you should not really require that booster pad. High quality, have a quality product, right selection, right size, and make sure we're applying it appropriately. And you should find the need that you may not have to have that booster pad. And I promised you guys earlier that I would give you some type of guide to really make this kind of button this up and make it really simple and easy for you to be able to find the right product for your family member, for yourself. And it's 3 steps. Level of mobility, right? If we're up and we're moving, I mentioned it several times, of being active and being able to toilet and maintain that independence, definitely want to be able to do that. Not mobile. Number 2, are we incontinent of our bladder, our bowel, or both? And then number 3, do we have light, medium, or heavy? And you can see we've taken all the information today and really just kind of buttoned that up in a quick glance at personalizing that care for your loved one. And keep in mind, if someone may need something during the day, it might be a protective underwear during the day. And Marvell, you were talking about your mom earlier, and I happened to think of this, a great scenario, maybe the protective underwear during the day and an adult brief at night, right? That way they're getting that extra protection. They're able to sleep through the night because they're secure and they're confident they're not going to have any accidents or leakage that's going to soil the bed linens. And we decrease that fall risk in the middle of the night as well because they can sleep through the night. And with that, one last piece before we kind of wrap things up, a little bit about traveling. It's okay, now we understand all of this. How do I prepare to leave the house? Because the goal is we've decreased that anxiety. We've made mom, dad, or grandpa confident and secure enough with the product selection that we have. They're ready to go back to church or they're ready to go back out to lunch. How do we travel? Well, the key here is plan ahead. Just like we all do with many things in life, you've planned this doctor's appointment, you're going to plan ahead. What I recommend, and it works very well, personally have done this with several family members and friends, pack a bag. Nobody needs to know what's in this bag. It could be a small travel bag, it could be a backpack, a cosmetic bag. My grandfather actually had a grocery bag in the back of his truck that had these items in it. Absorbent product, whatever they're wearing, additional bladder control pads, protective underwear, briefs, disposable underpads. We have those available so you can place it on the car seat or any other surfaces. Maybe it needs to go on the chair in the doctor's office. Have an extra change of clothes. Have some small plastic bags for disposable. So if you do have bladder leakage, that we have a bag to place the soiled product in, and certainly make sure you have some adult washcloths there as well to provide skincare. But remember, nobody needs to know what's in that bag but you, and just pack it and place it in the car in the trunk, and that way you've planned ahead, you're ready to go, and we can continue enjoying life and being happy, healthy from a physical standpoint, but also from a mental standpoint. And a couple of key takeaways. It's more common. I hope that you all have learned that today, that it's actually much more common than many think. It's not a normal part of aging. Simple little changes along the way from diet and nutrition could certainly help the overall quality of life. Start by finding the cause. Take a look at some of the things we shared today. Talk to your healthcare provider. Pay attention to the signs of incontinence, and really be there to help support your family in the event you are becoming new to a caregiver to someone experiencing bladder leaks. And communication is key. Again, make sure they're comfortable. We don't want to embarrass them. Make a safe environment, which I'm sure your caregiver, so you're giving them that love and compassion already. But really be comfortable and confident to have those conversations. They're not easy, right? I can speak personally to that again as we wrap up. Is when my grandfather started experiencing this, I had that conversation with him. It's not one that many granddaughters have with their grandfather, but he had learned over the years to trust me, and we had it. We were able to get him in the right product, and I knew that he was secure and protected, and let him kind of go through his day-to-day activities. And with that, Marvell, I want to
Yeah.
thank you. You guys, you and Caregiver Action Network, this was phenomenal. I appreciate the opportunity. First Quality appreciates the opportunity to talk today about this taboo subject. I really hope that we've erased some of that stigma today.
Yeah, I am quite certain that we have from the engaging conversation we've had and the questions in the chat. Just as a reminder, everybody, there will be this presentation will be available at our website, caregiveraction.org. And so for anyone that maybe want to watch again, or if you want to direct a friend or colleague, as well as follow-up emails will go to all the attendees that signed up. And also just keep in mind, at Caregiver Action, we have a single source, single site entry point for caregivers, where if you need whatever, if you're a caregiver and you're in need of something, give us a call. We can direct you to resources that you heard about today. We can also help you with really whatever may be your struggle for the day, or if you need guidance on it. So we encourage you to reach out either by dialing 855-227-3640 or at caregiveraction.org. Kim, thank you so much again for taking the time to be with us today. This was really great, and you guys have gotten your things down really well, because that was like a very tight hour. Pressed.
Well, thank you. And I want to add to Marvell. I was looking to see, I thought maybe I had it here, but thank you very much for your kind words, and we appreciate that. Certainly, we appreciate you being able to place the presentation on your website, and we're really looking forward to seeing what kind of questions that we all have today.
Yeah. So are there additional questions just in the time we have left here? We'll have our teams from First Quality and Can help us by just coming on screen, or just coming off mute and telling us what the question is, and we'll answer it as best we can.
It looks like are there any samples available for our agency? I'm assuming you're referencing Prevail. Certainly, you can go to prevail.com. I was looking to see if Rachel may have dropped that in there. Kind of to support with your Caregiver Action Network, you can go to prevail.com and talk to our nurses, right? Our e-nurse team is certainly there to help answer any incontinent questions and help that transition a little easier, and give you some feedback and direction as well.
Hi, everyone. Yes, I'm sure you saw me in the chat. We have had a number of questions around product types, around dementia support, around, resources for costs. So we definitely want to encourage you to lean on that eNurse team. Prevail.com/eNurse is where you can find them. And that's where we'll be able to really provide you that more one-on-one support with, how much you're from incontinence types to what size should I be buying. That's where our eNurse team is there to help. So I've been trying to funnel as we can through the chat, but please absolutely reach out to our team through there.
Thank you, Rachel.
Great.
Marvell, it has been a pleasure. Caregiver Action Network, thank you again on behalf of First Quality, and we appreciate the opportunity today.
Absolutely. Thanks so much. It was a great partnership today, and thanks to everyone for joining us. And stay tuned. I'm sure we will have more conversations just like this and others in the future. So stay tuned.
Thank you.
Thank
Bye.
you.
Everyone.